If you would, no, I mean, no, you can
It's a shift in the local medical community. St. Charles Health System plans to treat more cancer patients locally. Radiation oncology specialist Dr. Nick Bowling is working with a team on implementing new technology to treat women with endometrial cancer in Central Oregon.
So this is something we've been wanting to do for a long time, and it was a matter of actually buying some of the equipment.
The radiation treatment is called brachytherapy.
Cool it down.
In there.
Inside,
That's
right at the
crazy.
end, yeah. So
It has some advantages.
External radiation, it passes through a substantial amount of a patient's body. With this form of radiation, it's very localized. In this case, it treats a patient after they've had endometrial cancer, uterine cancer.
In endometrial cancer cases, oncologists treat what's called the vaginal cuff. After a patient has a hysterectomy to remove her uterus and sometimes other surrounding sexual organs, the vaginal cuff is created by suturing together the edges of where the cervix was attached to the vagina. By targeting the tumor site and the vaginal cuff, doctors are able to limit radiation to the pelvis.
So there's a shorter course of treatment, there's less side effects on treatment, and patients tend to tolerate it fairly well.
It typically takes 5 short treatments over a 2-week period.
Patients just lie on the table, the device is inserted into them, and once we verify the position, treatment can begin, and it takes maybe 5 minutes.
In the past, the St. Charles Health System has had to send patients to the Valley, which can be a strain logistically and financially, especially because these patients tend to be in their 60s, 70s, and 80s.
And some patients might choose not to get treatment because of the challenge. So we feel like, some patients aren't getting all the treatment they need. And we don't want to think that logistically, that just because we didn't have the equipment, a patient's not getting proper cancer treatment.
But that's all changing.
We've had a unit called a Zoft, which is a form of brachytherapy, and we finally bought the correct applicators, essentially, the devices that we use in the patient.
Those applicators cost around $20,000. They're looking into acquiring more applicators the hospital can invest in to treat other forms of cancer such as breast or skin cancer. So how does radiation therapy work?
The radiation works by damaging the cancer cell's DNA. Normal cells can typically recover from this damage that's delivered from the X-ray radiation. The cancer cells are dysfunctional, and therefore they can die from the radiation itself. So by delivering enough radiation, you can kill off the cancer cells.
We're told there's minimal discomfort.
In general, patients tolerate it. We actually size them and we fit them with a device that actually feels comfortable enough, can fit adequately. Once the machine's off, there's no more exposure, patients aren't radioactive, children can sit on them, there's no concerns. And patients just continue on with their regular lives once treatment's done.
After radiation therapy, doctors monitor long-term side effects. But Dr. Bowling says they don't usually see them with this treatment.
It's nice to get treatment in your home.
There's a small risk of a second cancer caused by radiation therapy, but he says with the older population, it's less of a risk than with a child. Dr. Bowling also says not every patient with endometrial cancer will need additional therapy. It's just the women at higher risk for the cancer to come back. In Bend, Audrey Roberts, News Channel 21.